Alright, so today we're going to talk about arthrogryposis, a rare congenital disorder that affects multiple joints throughout the body. People with this condition experience muscle contractures due to abnormal fibrosis of the muscle tissue. This leads to muscle shortening around the joints, causing restricted movement or even immobility in many cases. We'll dive deep into the pathology, causes, symptoms, and treatment options for this condition, including how it's diagnosed and managed in clinical practice. Whether you're a medical student or simply looking to understand this rare disorder, this video will give you a comprehensive overview. Let's get started. Arthrogryposis, also known as arthrogryposis multiplex congenita, is a non-progressive congenital disorder characterized by multiple joint contractures present at birth. This condition affects the muscle and joint development of the fetus, and its severity can vary, ranging from mild to severe. What happens in arthrogryposis is that fibrous connective and adipose tissues replace normal muscle tissue. This leads to muscle shortening around the affected joints, making it difficult, or even impossible, for the joints to move or extend properly. The joints often remain stuck in flexed or extended positions, limiting the person's ability to perform everyday tasks. Typically, the condition affects multiple joints, including the arms, legs, hands, and feet, though it can also involve the jaw or spine. The exact cause of arthrogryposis isn't fully understood, but researchers believe it can be attributed to factors that affect fetal movement during pregnancy. Decreased fetal movement leads to underdeveloped muscles and joints. Some potential causes include neurogenic disorders, such as anterior horn disease, uterine malformations that limit fetal movement, and oligohydramnios, a lack of amniotic fluid that reduces space for normal joint and limb development. Genetic mutations, including disorders like spinal muscular atrophy type 1, are also potential causes. About 70 to 80% of cases are linked to neurological issues, impacting muscle and joint development before birth. The symptoms of arthrogryposis can vary depending on the severity and specific type, but common signs include joint contractures, muscle weakness, and limited range of motion. Conditions like club feet, hip dislocation, or internal shoulder rotation are also typical. Some individuals may experience spinal deformities like scoliosis, which further limits movement, making it difficult to walk, stand, or use their arms without assistance. There are different types of arthrogryposis. The two main types are amyoplasia, the most common form, which typically affects most of the body's joints symmetrically, and distal arthrogryposis, which mainly impacts the hands and feet and is often associated with genetic defects. Diagnosing arthrogryposis usually begins with a physical examination to assess joint mobility and muscle strength. Doctors often look for congenital joint contractures affecting multiple joints. Diagnostic tools, like ultrasound, can sometimes detect the condition prenatally by showing low fetal mobility or abnormal positioning. MRI and genetic testing are also used to evaluate the muscles and detect underlying causes. One major complication of arthrogryposis is difficulty with walking, which can severely limit independence. Psychosocial effects, like shame, depression, and social anxiety, are common, especially in children who may feel isolated from their peers. While there is no cure, treatment focuses on improving joint mobility and muscle strength. Surgery may be performed to correct deformities, while occupational and physical therapies help maintain mobility. Techniques like joint manipulation, casting, and the use of limb-enhancing devices, such as splints or braces, are essential. These interventions can help patients lead relatively independent lives, though long-term support may still be necessary. To summarize, arthrogryposis is a rare congenital condition that affects muscles and joints, causing limited mobility and contractures. Though there's no cure, early diagnosis, surgery, and rehabilitation therapies can significantly improve the quality of life for those affected. If you found this video informative, don't forget to like, subscribe, and share it with your friends. For more in-depth resources on medical topics, check out King of the Curve for interactive learning tools and study materials. Thanks for watching, and good luck with your studies.